Good morning. Today I'm joined by Shannon Mantha, Executive Director of Clinical Services and Chief Nursing Officer, to give an update on our local COVID-19 situation, and Andrea McLellan, Director of COVID-19 Immunization Strategy, who will provide an update on the vaccine rollout. Before we proceed, I would like to take a moment to acknowledge that the health unit resides on land covered by the Robinson-Huron Treaty of 1850. This land is the traditional territory of the Anishinaabe peoples of Nipissing First Nation, Doki's First Nation, Temagami First Nation, Wissahickon First Nation, Shawanaga First Nation, Magnetawan First Nation, and the Inlet First Nation, and Moose Deer Point First Nation. This land is part of the unceded territory of the Algonquin Nation. I would also like to acknowledge the Métis historical presence in the region. We are grateful for the opportunity to meet here, and we thank all generations of people who have taken care of this land for thousands of years. As a health unit, we acknowledge there's still much work to be done in the spirit of reconciliation. I would like to recognize that June 21st is National Indigenous Peoples Day. This is a special day for all people across Turtle Island to recognize and celebrate the history, contributions, sacrifices, and strengths of Indigenous peoples. Although celebrations will look very different this year, we encourage everyone to attend one of the virtual events being hosted by local Indigenous organizations and communities in this area. Last week, the province moved into step one of the roadmap to reopen. This step forward means some restrictions were lifted and outdoor gatherings of up to 10 people are allowed. This also means that non-essential businesses can open at 15% capacity, and outdoor patios may operate with some restrictions. Although there were many lineups to get into stores this weekend, I want to thank those who were following public health measures, including physical distancing in the lines and wearing face coverings. Locally, we are seeing an increase in the number of people testing positive for COVID-19. It is important that we continue to work together by following public health measures to help prevent further spread within the community. With that, I would like to hand it over to Ms. Mantha to provide an update on our local COVID-19 situation.
Thank you, Dr. Chirico, and good morning, everybody. In the last 7 days, we've seen 32 new cases, bringing our total case count this morning to 504, with 335 of those cases being in the Nipissing district and 169 within the district of Parry Sound. At present, this morning, the health unit currently has 44 active cases of COVID-19 in the community. It's important to note that although the provincial case counts seem to be steady around 500 a day, our case counts continue to climb. There are currently 16 active cases in the community that have tested positive for a variant of concern, all of which are the Alpha variant, which is formerly known as the variant originating in the UK. To date, there have been 2 Delta variant cases in our region, both of which are now resolved. Late Saturday evening, the health unit was notified of 2 confirmed cases of COVID-19 in members of the North Bay Jail community. Upon further investigation, we declared an outbreak in Corridor 3 of the facility. COVID-19 testing was initiated for all staff and all individuals in custody. And as of this morning, 13 people have tested positive for COVID-19. 12 are associated with the outbreak, and 1 was determined to be community acquired. Due to evidence of transmission within the facility, as I mentioned earlier, the outbreak was upgraded to facility-wide. No COVID-19 infections related to this outbreak have resulted in serious illness that requires hospitalization. As in any outbreak, we're working very closely with North Bay Jail, as well as the Ministry of the Solicitor General, to offer COVID-19 vaccines to individuals in custody, as well as North Bay Jail staff. We will continue to inform the public as the situation at the North Bay Jail evolves, or when the outbreak has been declared over. And with that, I'll turn it back to Dr. Chirico.
Thank you, Shannon. And we'll turn it over to Andrea, please.
Thanks, Dr. Chirico. Good morning, everyone. As of yesterday at 3 p.m., we now have 72% of adults 18 years of age and older who have received at least one dose of the COVID-19 vaccine, and 15% of adults 18 and over who are fully immunized. Additionally, 41% of youth aged 12 to 17 years of age have received at least one dose of COVID-19 vaccine. Also, as of yesterday at 3 p.m., we have provided a total of 93,625 vaccinations in our district. Individuals 70 years of age and older, as well as individuals who have received their first dose of COVID vaccine on or before April the 18th, are now eligible to book their second dose of COVID-19 vaccine. We are seeing great uptake for second doses, with the majority of appointments at our clinics being people receiving their second dose. Due to the high uptake for second doses we are seeing, we have opened our standby list to include those who are eligible for their second dose. As a reminder, the standby list allows eligible individuals to receive a dose of vaccine that may be left over at the end of our clinics. Individuals can put their name on the standby list by filling out the online form on our appointments and clinics webpage. It's important to note that at the end of each day, the standby list is cleared of all names and a fresh list is started the next morning. We have seen an increase in the number of individuals showing up at clinics without an appointment who are requesting a dose of vaccine. We would like to remind the public that individuals cannot get leftover vaccine doses if they are not on our standby list for that day. Our clinics have been filling up quickly. However, we do still have many appointments available at the end of June and early July. Please call or go online to book your appointment. Today, we have appointments available in both Mattawa between 4:30 and 6, and in North Bay at Memorial Gardens between 4 and 8 p.m. Appointments for these clinics cannot be booked online. Please contact the Health Unit's call center at 1-844-478-1400 if you wish to book an appointment for either of these clinics. You can also contact a participating pharmacy to schedule an appointment. You don't have to get your second dose at the same place you received your first. Due to the supply of COVID vaccine, we are unable to guarantee a specific brand of mRNA vaccine at each clinic. Planning for second doses at our clinic includes looking at ways to accommodate a supply of both Moderna and Pfizer at all clinics. It is important to remember that the National Advisory Committee on Immunizations, as well as the Ministry of Health, have both approved the mixing of vaccine products if the vaccine you received for your first dose is not readily available. We encourage everyone who is eligible to book their appointment as your vaccine isn't fully effective until 14 days after your second dose of vaccine is received. And now I'll turn it back over to Dr. Chirico.
Thank you, Andrea. So that concludes our remarks, and we'll start answering questions. You can put your questions in at the top of your screen. And please remember to, if you can, to put your name associated with your question. So I'll now turn it over to Alex, please.
Thank you. So our first question is going to be for Shannon Mantha. It comes from Chris Dawson from Bay Today. Can you give an update on the status of cases related to the police services?
Hi, thanks, Chris. So as you're aware, and we've said multiple times, we don't provide information at an individual case level. What I can say is that whenever a case is identified at any employer, such as the North Bay Police or any other institution or employer in North Bay, we do follow up with all cases and anyone who's been indicated as a high-risk close contact to make sure individuals isolate immediately, get tested, and then we continue monitoring them for the duration of their case and contact management period. So I think any additional questions related to North Bay Police Service could be directed to their media person at North Bay Police.
Thank you. Our next question is also for you, Shannon. It comes from Jennifer from the Nugget. Do we know how the outbreak at the jail started? Was it from an inmate who was brought in from another community?
Sure, yeah, thanks for that question, Jennifer. So we know there's community transmission of COVID-19 in the district. So as long as we have COVID circulating in the community, there's always continued risk that COVID will enter and then spread into facilities such as North Bay Jail. From early on in the pandemic, congregate care settings in the district have worked really diligently to maintain COVID-19 precautions, like things like testing, new admissions, daily staff screening, use of PPE, and then rigorous cleaning and disinfection protocols. Despite these measures, we do know that COVID-19 can, and it does enter facilities. A main goal of outbreak management is to identify cases quickly and then isolate them to stop the chain of transmission. And the surveillance testing that's occurring both among staff and as well as individuals in custody is really a critical component to identify cases and then manage them accordingly. So part of our investigation outbreak will try to determine if there was an index case or a source of the outbreak. We can't always find that information or uncover it. But it is likely that the community transmission is also impacting transmission within the jail or cases within the jail.
Thank you. Our next question is also for you, Shannon. It comes from Rich Kaufman at Moose FM. Understanding that you can't get specifics with the recent COVID-19 cases that are not a part of the outbreak at the jail, should anyone's safety protocol be highlighted more than others, i.e. stay home when sick, follow gathering limits, and so on?
Yes, that's a great question. And I'll start, and then I don't know if Dr. Chirico may want to add something. So I don't think it's simple to pick out one of the individual public health measures or precautions that have been put in place in relation to preventing COVID-19 transmission. They're all part of a package that's critically important. And I think as the province reopens and vaccine rollout continues and more individuals are vaccinated, there's a lot of hope. And I think that sometimes we see a little bit of easing of restrictions from the public, and maybe people aren't following the measures as strictly as possible. This is really the time right now to continue with those, just really continue with all of those measures, and keep all the public health measures in mind. Get vaccinated when you have the opportunity. Get tested if you're sick, and isolate immediately. So I can't really pick out one measure that's more important than the other. They're part of a package that's critically important.
Yeah, thank you, Shannon, for that. And I would certainly agree with everything that you said. It was very comprehensive, and that's the approach that we have to take. I think it's important to recognize that while the case numbers throughout Ontario, as well as hospitalizations, as well as vented patients, percent positivity rate, a lot of the indicators are moving in the proper direction. They're going down throughout the province, which is really, really encouraging. However, we also have to be mindful that there are certain regions within Ontario that are seeing increasing cases of the Delta variant. So they account for about a third of the cases in Ontario. So we still have to be very careful. We have to monitor it closely. We have to watch and see what happens over the next couple of weeks. And this is why we're moving slowly through the steps, so that we can keep an eye on the situation and adjust accordingly. So all of those measures, and I know it's difficult. People have been at this for a long time and are tired of it. But it's our reality that we have to face. And so by following the distancing, the face coverings, as well as many people as we can get vaccinated as quickly as possible, that's all going to benefit everybody in the long run. And we want this to be our last shutdown that we've had in the recent past.
Thank you. Our next question is for Dr. Chirico. It comes from Chris Dawson from Bay Today. Dr. Chirico, what is your message to those who are having or are planning to have large gatherings or parties?
Again, just and in response to the previous question, it's the same message that we're trying to get through to people, that when you do things like that, first of all, you're contravening, the step one gathering limits. And while you think that, it's safe to do so, it isn't. That's how these outbreaks start. That's how we start to see increasing numbers of cases, when people become complacent and don't follow these measures. And it only takes one in order to have a significant outbreak. So we're asking people to use your good judgment. I know that it's difficult to want to continue with these measures, but it is essential. And if we don't do it now, we're going to have to be doing it later, and we don't want that. So please, we ask that you adhere to the gathering limits and not have these large parties, and because it certainly can have a significant effect on the rest of the population.
Thank you. Our next question is for Andrea. It comes from Rich Kaufman at Moose FM. Can you offer more details on the free rides to youth COVID-19 vaccine clinics?
Hi, thanks for the question, Rich. The school board and the school board transportation system have put a process in place where individuals who may experience barriers related to transportation in attending a youth clinic can contact the school board and the transportation system there, and they will arrange for a ride for a youth to a clinic. That information was distributed to all all eligible students' families for those who are 12 to 17 years of age who may be looking to attend a clinic. So all families are provided with that information.
Thank you. Our next question is also for you, Andrea. It comes from Sarah Bissonette at the North Star. There are no appointments in Parry Sound as of yesterday. Will doses be reallocated if spaces available in North Bay and Mattawa?
Hi, Sarah. Thank you for that question. Actually, there are a number of clinics available and spots available in Parry Sound as of this morning. There were a number of clinics and dose increases that were in progress yesterday that have been completed and are now up and live on the website.
Thank you. Our next question is from Shannon. It comes from Jennifer from the Nugget. There are 13 positive cases at the North Bay Jail listed. Are the 13 positive cases at the North Bay Jail listed in our local numbers? And do we know if those individuals who are infected have received at least one dose of the COVID-19 vaccine?
Sure. Thanks, Jennifer. So yes, those numbers are listed in our case counts. Absolutely. They're also tracked on the Solicitor General's website. They do report on cases of individuals in custody. So in terms of vaccination rates among those individuals in custody, we do know, we work really closely with North Bay Jail and to gather that information as part of our case and contact management. So I'd say there's varying coverage. We do know that on April 29th, the health unit did offer first doses of COVID-19 vaccine to individuals in custody at the North Bay Jail. And the vaccine, keeping in mind, is voluntary. About just over 45% of individuals in custody chose to be vaccinated in late April. And then this Friday, individuals in custody will be offered either their first dose or their second dose of the vaccine. And for North Bay Jail staff vaccination rates, you can connect with the Ministry of the Solicitor General for that information.
Thank you. Our next question is for Andrea. It comes from Pauline. Since we have openings today, will you open up to individuals who received their first dose after April 18th?
At this time, no, we will not. The number of appointments available is not a large number of appointments. And so we are reaching out to groups that are eligible to receive their vaccine. And we will be following the provincial recommendations for the rollout for second doses.
Thank you. Our next question is for Dr. Chirico. It comes from Clark from Your TV. Good morning to all. What are the factors that at play that will reduce or eliminate the evolution of variants. Many people are frustrated that while the provincial case counts are extremely encouraging, news then comes out regarding the threat of variants.
Yeah, that's a great question. Thank you for that, Clark. It's normal in a pandemic when you have a virus like this that every month you're going to see a number of mutations that will occur, and that's the natural evolution of the viruses in a pandemic. What it really depends on is, what the mutation is, how serious the mutation is as far as transmissibility, and whether or not people get really, really sick from it, and or does it affect the vaccines that we currently have? Those are the questions that we ask. But as far as being able to, put a halt on the spread of these variants, I think it's really important to look at the very simple measures that we have instituted already. And the biggest way to minimize the effect of the variants and their spread is to follow the public health measures while we get as many people vaccinated as possible. So the simple things, again, the physical distancing, assuming that everybody has the variant that you come in contact with, so you take precautions, and as well as wearing the face coverings as well, and washing your hands. Those simple things are very important, and they're the mainstay right now until we can get enough people vaccinated, until there's enough herd immunity. Those are the best way to fight against the variants. Use your best judgment, use good judgment.
Thank you, Dr. Chirico. Our next question is also for you. It comes from Chris Dawson from Bay Today. Can you comment on the efforts of your staff through the COVID-19 pandemic?
Yeah, thank you for that. It's a good segue into saying how proud I am of the staff and the work that they've done. They've been relentless and working nonstop, and a lot. I mean, we don't have a large staff, but what we have done certainly is gotten the staff to really work in so many different areas, and they just do it and do it with a smile, and they've done a fantastic job to fill in to wherever the need is. And I'd also like to point out too that it's not just our staff. I mean, we've had a lot of volunteers. We've hired people. People have, the whole community has stepped up, and the primary care, the hospitals, everybody throughout, and many service organizations have come together to really fight, this battle together, and it's just tremendous what they've all done. So really, really proud of them, and it's not over yet. And I know that many people are tired, and the public has done a great job to keep the numbers low as well. But we got a little ways to go, and we'll rise to the occasion, and we'll get to the other side of this.
Thank you. This question is for you, Dr. Chirico. It comes from Jennifer from the Nugget. Is there public concern with the mixture of vaccinations?
Yeah, thanks for that, for raising that, because it is a question that much of the public, are wondering about, and they're saying, well, so what is the reasoning behind this? Well, I think that what we can say is that yes, there is concern about it, but what we have found, and the evidence has shown, is that mixing of the vaccines provides a greater opportunity for people to get vaccinated, and it's been found to be effective and very safe to do. So this is really an added benefit of having the different types of vaccines, because we can, and the evidence is showing that we can mix and match, so we can get more people vaccinated, we can get them vaccinated quicker, and it's very helpful.
Thank you. Our next question is for Andrea. It comes from Clark from Your TV. Once the outbreak was declared at the local correctional facility, was the priority to vaccinate inmates or jail guards and staff?
Priority was to immunize both groups, and both groups will be offered vaccine.
Thank you. Our next question is for Shannon. It was submitted anonymously. Has there been an outbreak among the homeless population?
Sure, thanks for that question. Throughout the pandemic, the health unit, as well as all community partners in social services, healthcare, and other sectors, have been extremely concerned about marginalized populations, such as individuals who are underhoused or who are without housing at all. So, you know, what I will say is that the health unit's currently working with community partners to reach people who face barriers accessing COVID-19 testing, vaccinations, as well as other critical supports. And in April, the health unit collaborated with many community partners to vaccinate just over 50 individuals residing at local shelters in North Bay. And in the Parry Sound District, we did collaborate with community paramedicine to vaccinate individuals who are underhoused or living in shelters. So anytime a case is identified in any setting, and we follow up immediately, do case and contact management to the best of our ability. In circumstances where an individual may be underhoused or without housing, there's added complications to that entire process for public health, as well as community partners. And that's why we really try to collaborate with community partners to wrap around clients who may be marginalized and support them with self-isolation and all of the other important public health measures.
Thank you. Our next question is for Dr. Chirico. It comes from Jennifer from the Nugget. There's several politicians who are encouraging Premier Ford to skip to step 3 as the province meets all the vaccination rates, a continuing decline in ICU rates and hospitalizations. Even though we're meeting those targets, do you still support the 21-day intervals in between stages?
Well, thanks, Jennifer, for raising that. It's a very important point. And quick answer, absolutely not. I believe that we need to wait that 21 days. I think it's really important, and we have to learn from our past experience. And we've said it over and over and over again that the quickest path to a prolonged, sustained reopening is not to move too quickly and to resist the temptation to open quickly. It takes about 2 to 3 weeks in order for impacts because of the incubation period and transmission. It takes about that period of time before you know the full impact of what you've done with loosening of restrictions. So if you move too quickly and open things completely open, we may end up back to where we started from. We don't want to do that. So absolutely stick to the plan, stick to the 21 days.
Thank you. Our next question is for Andrea. It comes from Eric Thompson. The percentage of residents who have gotten their first dose seems to be slowing down. It was around 70% at this time last week. Is the health unit still seeing an interest in people booking their first appointment?
Yeah, thanks for that question, Eric. Yes, we are starting to see a slowdown in the number of individuals booking first appointments, but we're seeing about a 25% to 75% ratio of first to second dose appointments at our clinics, but we are still receiving calls and still booking people for first doses as well.
Thank you. Our next question is for Shannon. It comes from Eric from CTV News, asking for clarity. How many cases in the North Bay jail are that of the Delta variant, if any?
Yeah, thanks for that. So we don't have variant results for cases at the North Bay Jail. So there, as of today, there are none that are confirmed as Delta variant. I can say that. And we previously, as I think I mentioned in my opening statement, we've had 2 confirmed cases of Delta variant in the district, and they are both resolved.
Perfect, thank you. This next question is for Andrea. It comes from Sarah Bissonette from the North Star. Vaccine uptake seems high here. How many doses are given each day, and how many could be given if the supply was on hand?
Thanks for that question, Sarah. I'm assuming you're meaning specifically for Parry Sound. The number of doses available at clinics varies across the district and depending on the clinic that's being offered. And there's a lot of factors that play into that. It's not just the vaccine availability, it's also availability of the location, it's availability of staff as well. Our clinics have run anywhere from 480 doses at a clinic to 2,400 doses at a clinic at some of our larger scale clinics. And so we work with each of the communities to determine the appropriate number of vaccines for those communities and schedule our clinics accordingly.
Thank you. Our next question is also for you, Andrea. It comes from Rich Kaufman at Moose FM. Did you expect we would be at 72% of vaccination rates by now?
Thanks for that, Eric. That's a tough question. Had I hoped we would be? Absolutely. Did I think we would be? Depended totally on vaccine supply. So I'm very pleased that we're where we are. The uptake has been great. The support from the community and the turnout at our clinics has been great. And I think it's been very helpful having vaccine available through our mass immunization clinics, through pharmacy channel, through primary care channel, through a number of community partners who are working with us to help us to distribute vaccine to eligible individuals. I think everybody working together is the reason we're at 72%.
Thank you. Our next question is for Dr. Chirico. It comes from Eric Thompson. Are you concerned that the health unit is hitting a wall when it comes to providing a first dose to residents? Are there any plans in place on how to reach this final 28%?
Well, thank you for that, and that is a great question. I think that it's anticipated that you are going to, as you put it, hit a wall. You're going to reach the level where you do have it trailing off, and you can't expect that 100% of the population will be vaccinated. I think that you raised a very good point as far as, so what can we do to reach the remaining? Well, what we're doing is that we're still promoting and to get vaccinated, and we're making first doses available with the clinics. We're going to be having more vaccine anticipated to be coming, and so people that haven't had a chance or may have changed their minds about getting vaccinated, the opportunity is still there. So we're still going to be promoting it. We're still going to be having campaigns sort of through social media, through the usual media to encourage people to get vaccinated. I don't think it's realistic to expect that we're going to get 100% of people vaccinated. It's not going to happen. And so that is going to be our message. The best chance to get this under control is to get as many people vaccinated and eventually get as many second doses into people as possible. I don't anticipate that happening until likely the end of the summer, and early fall before that happens.
Can I just add to that as well,
Yeah.
that one of the things that we are doing is we're starting to pull some demographic data to see if we have pockets within our district where uptake has been lower, and then working with those communities to try and identify strategies to increase access and to identify barriers to immunization to help ensure that everybody's had access to the vaccine.
Thank you. So that completes our submitted questions for the press conference. So that will conclude our press conference for today. The recording will be available on our website this afternoon, and we will see you all next week on Thursday at 10 a.m. Thank you.
Thank you.